CCFC Promise is a maternal and child health project that seeks to reduce maternal and infant deaths in 3 African countries, namely Ghana, Malawi, and Rwanda. We are intervening at 3 key levels, improving the delivery of essential health services to mothers and children, and then also improving the utilization of these services which are provided at the health facilities where we are working, and also increasing nutrition, making sure mothers and children eat the right mix of food to get optimum health.
The Promise project has achieved tremendous results over the past 2 years of implementation. The percentage of women who access skilled delivery from health facilities improved from 64% to 84%. The percentage of women who access postnatal care also improved from 41% to 67%. Knowledge of contraceptives of men and women, adults, also improved significantly, with a female from 68.6% at baseline to 79%, whilst that of males also improved from 58.9% at baseline to 90% at the end of year 2. Seeing the communities happy, smile, and eager to use the services that they were not willing to use before is really fulfilling.
When we began the project, most of the facilities that we worked with were not having adequate staff who could deliver midwife services, that is, handling labor cases. Through Promise, we have been able to provide a training called task sharing, where community health nurses are provided the needed skills. They can handle labor cases and then deliver pregnant women.
The deliveries I do, I feel happy because it's something I have learned and I've been able to practice. So whenever I deliver, I conduct delivery, I'm always happy because I have done it. I have saved life or to render good quality healthcare.
Beyond the capacity building, we have also equipped 30 health facilities that did not have the basic equipment to provide essential services to mothers and women. So in most cases, when women go for services or children are sent for services, they would be referred to higher level facilities, and they are either not able to go because of distance or financial reasons. But as a result of the work that Promise has done in these health facilities, essential health services are now available at the doorsteps of the communities that we serve.
People are now more concerned about their health as compared to before the project. Through sensitizations and education, constant contact with them, showing them how to take care of themselves, the importance of sanitation and their health. So from my point of view, I'm very glad being part of this project because I get closer to the people, to be able to change lives. And I can see a lot of change, even though it's not immediate, but there's a gradual improvement in the way people think concerning relating it to their health.
Do awat polo yamala bipem sen ma anda do ola yengo katien do second ma ka aship ma kana yengo kan do yengo ma mi do abama dra nang ma tom gari aship tana do abama dra do yengo ma anda ka lafi bay dra tien do second ma ka do aship tana nda nya lafi ye I aship ma de happy to sham nyami Promise nam na zanga aship ma kana yengo do fata ba epa ensu ipsela so if you never be aship ma na kana yengo ma mi Promise nam na zanga aship ma kana yengo the fata ba epa
to yamal nguna Promise nam ma bindana ka ti yengo tumban so ku ben be akwen yisime ndi piligi tumatumbo mbe sumbi ikom be ya chaka nkol dundong be pa amana nko yisila la kari piligi ko botu shakandi tumda.
The communities that we are working in, transportation is very, very difficult. The send their clients through motorbikes, which is not always safe. The distances that they travel from are also far. But when Promise came, we've been able to provide the facilities with tricycle ambulances that are addressing the key challenges associated with the referral system. Now, when pregnant women are in labor and they are sent to the facility, if the in charges or the health officers realize that it is beyond their control, they quickly organize and then put this client in the tricycle ambulance and then send to the next level for attention and care. And if you combine all these factors together, you see that Promise has been a success and has made a great impact within the communities that we are working.
One of the factors that also ensures quality of care is the availability of essential medicines when they are actually needed. Before the Promise project was introduced in our districts, shortages of essential medicines to pregnant women was one of the problems that were encountered. Through the Promise project, we have been able to sustain a flow of supply of essential medicines where no pregnant woman goes away without receiving the essential medication that she needs during the pregnancy.
If Promise were not here, maternal mortality and infant mortality was going to continue. I mean, there will always be deaths, but there are deaths that can be avoided. And those are the ones we are seeking in partnership with the health system and communities. So I think that Promise has been a huge blessing in the communities where we are working.
I am a person who always believes in the fact that there is no reason for a woman to go to give birth, to deliver, and then die. There is no reason for a woman who wants to give life, lose her own life. For the 2 years that we have been operating, these maternal deaths and infant deaths has reduced within the districts that we are operating, and none has occurred within the communities that we are operating, and this is a great success.
Christian Children's Fund of Canada, or CCFC, we've been in existence for 60 years. We are a child-focused development agency. We work globally. We currently work in 12 countries. Our primary mandate is to ensure that children have the opportunity to realize their dreams. And the work we do and the interventions that we focus on, education or access to education, access to health care, water and sanitation, child protection and gender equality are key cornerstones of the interventions that we support. We are happy to say that based on the work that we've done, our legacy is that communities have been transformed, partnerships have been forged, and we've done well to ensure long-term sustainability. How thrilled we are that we are able to work in partnership with our government here in Canada, but also to work in partnership with Emmanuel International as well as ADRA. I think we all share the same passion in terms of ensuring that the outcomes are consistent with what we initially envisioned. We've been able to just not impact communities, but we've been able to forge new partnerships with local government, with healthcare workers in different parts of the world. And these are the hallmarks of what we call sustainable development. Because we're so happy with the outcomes of Promise, we feel there is tremendous potential to do more. The problem is not going to go away. It's important for us to ask key questions around sustainability to say, what we've achieved in year 4 of Promise, is that good enough? Can we do more? And if there's an opportunity for us to do more, why don't we continue this partnership?
I think one of the things that I like the most about the Promise project in Rwanda is the location that they chose to do the project. They basically chose this project because of 2 reasons. One, because it had a high incidence of malnutrition in young children, but also the other big reason is it's the driest region of Rwanda. In many other parts of Rwanda, you find people being able to grow 3 crops every year. But in this region of Rwanda, because it's so dry, they really only have a growing season of about 3 or 4 months, which means that the food that they have to grow for the family for the whole year has to be done just in those 3 or 4 months. And one of the main aspects is to teach families how to extend that growing season through a variety of permaculture methods that help people to not only harvest water, but also to preserve and conserve water as they do their agriculture. And this has been a transformative effect of the program.
We help to establish kitchen gardens to ensure that families have access to nutritious foods. And we support them to understand about nutrition, which is a key factor in ensuring good health for the children. We provide tools for the gardens. We provide seeds, fruit trees, different kinds of vegetables that they have not known before. And today, when you talk to the children, they can name the different types of vegetables.
Murakoze, umushinga urebye waziye igihe kuko hari ibintu byinshi watugejejeho tutagiraga. Icyambere tuva mu myumvire y'abandi baturanyi, ntabwo ari twebwe twenyine, adara iki twari turi inyuma tutazi guhinga. N'amasomo umuntu nakumva yuko yaduhaye amasomo menshi umuntu ashobora kwigira no mu mashuri, ariko iyaduha hafi, yadusangisha hafi.
The Promise Project has also introduced what we call men's clubs, which is disseminating information about gender equality and being sensitive to gender issues and introducing men to take up household tasks and do roles that they may not have done before.
Through drama, through songs, through plays, it is all packaged. And because it is the men that are doing it, their fellow men that are not part of the men's club are very eager to listen and implement what they have learned through the men's club sensitization campaigns.
So we decided to engage men to help us to promote maternal, newborn and child health so that they can be a key players in these issues of MNCH.
More men have taken up the importance and support for their women in the day-to-day chores, whereas before the project, you will hear testimonies. Men would go drinking, they would not support their wives. All they needed is food on the table. But today, you will find men supporting their wives, going to fetch water, fetching firewood, cooking, taking their children to the hospital, and showing care for their wives because they have now appreciated the fact that their wives are part of them. When their wives are okay, then they are happy.
Nari mfite umusarani w'ikinogo upima metero 2 nazo ziburaho nka santimetero nka 50. Turabikora icyambere yo tukimara kwicara nka karabu y'abagabo. Icyo gihe tubanza kuganira, ikindi tukaza kureba uwitwaye nabi muri karabu yarahohoteye nk'umugore cyangwa se umuryango cyangwa se afite ibikorwa bimeze neza nk'ibyo karabu idusaba.
Mbere yuko uyu mushinga wa Daruza impinduka zaraje, mbona arahindutse, kunywa arabiretse, kurwana mu rugo biragabanyuka birarekera. Ubu arafata ijerekani akazana amazi, ntaba netse agakarabya abana, ntaba ndwaye akamfurira nk'igitenge cyangwa kimwe agafata umwana akamujyana kwa muganga. Ni byinshi byahindutse.
Cyambere no kubashimira ku nkunga mwatugejejeho, bifite aho zadukuye naho zitugejeje. Nabanza kubashimira kuri icyo.
Ni byinshi, igitenge yo nakibuze nta mafaranga hari, nyine ndabyihanganira. Nukuri mwarakoze kandi.
Promise Project has also started a number of adolescent mothers groups. And this is targeting young girls, perhaps teenage girls who who got pregnant before they were married. And as a result of these clubs, these girls are now coming out of hiding, and they've found a new confidence to walk down the street holding their baby and not be ashamed.
Apart from being a support group where they support each other, share and encourage themselves, they do reach out to the community. They go to schools, they go to the communities, and they play dramas, songs that are packaged with information about maternal child health, sensitizing mothers on how to take care of their children, sensitizing both the husbands and wives on how they can work together, promoting gender equality in their homes so that their families are healthier and are able to take care of their children and bring them in a healthy environment.
Uburyo nayinjiyemo naje guhura n'ingorane njya nkiri mutoya, haje kuza umushinga wa Dara Promise kandi nkumva nyine ntabwo binteye ipfunwe kandi bakajya bamfasha kugera aho abantu benshi bari nkishimana nabo, kuko mbere nahoraga mu nzu kuko nta nubwo nifuzaga yuko n'umuntu nk'uyu w'umuzungu yanambona mpetse umwana. Nkaharanira yuko bitazongera bitewe n'ibyo Adara Promise yatwigishije, kandi iteka mparanira kubyigisha n'abandi kugira ngo babyirinde ari abo byagezeho. Gusa abaho ijambo rirenga murakoze nakarikoresheje, ariko bitewe n'uko mba niyumvamo niyo ndyamye ndabitekereza. Gusa warankoreye bivuze ngo wenda niyo Adara itahawe yarapfuye.
ADRA is the humanitarian arm of the Seventh-day Adventist Church. ADRA actually stands for the Adventist Development and Relief Agency, and we're actually part of a worldwide network of over 130 different country offices around the world. ADRA's motto is actually justice, compassion, and love, and that's how we conduct our work. We go forward to try to correct injustices in the world, to try to improve the inequalities that we see around the world that we live in today. Then on the development side, we try to identify impoverished communities around the world. So helping to try to lift people out of poverty, to improve their living conditions, and to actually leave them in a more sustainable condition after we leave. Being part of the Promise Coalition allowed ADRA Canada to work with 2 other Christian organizations. The nice part of it is when we see the reports that are coming from the field, we're receiving information about how we've just really significantly changed people's lives. So we know that when we leave from the project area, we know that we've left people in a better condition. So as Promise is coming to an end, we've actually been in correspondence with the other 2 partners of our coalition to say, well, what can we do next? Where we can take what we've garnered from this first project, look at what are the best parts of the project, and how can we design a project to go forward and serve and change the lives of even more people.
Promise project has made difference. When we were starting in 2016, most of people in the communities were giving birth in the community. But with the coming of Promise project, things have changed. Most of them, they are now giving birth at the health facility. In the area of strengthening the health system, we trained and equipped these nurses and the clinicians. They are now able to deal with other obstetric conditions at the health facility.
This facility, we provide care to the mothers and children, and especially the newborn babies. The newborn care involves providing warmth for the baby, making sure the babies are clean, and also making sure that there's been bonding between the mother and the child. And to the mothers, we also help them so that they can have a safe delivery, and also help them psychologically to cope with the new baby. And we also teach them how to take care of those new babies so that there cannot be new infections to those newborn children. Mainly, we also educate them and then help them to have their immunizations before they go home. Giving care to this is very good, and as for me it's a good experience because seeing a new couple who didn't have, let's say, a baby for a long time, and then when you see them having a live baby, a happy baby, and seeing that they are smiling, it's a very good experience as a midwife working with the parents.
Access to health care services can be really difficult if you live far from the health facility or if you don't have any emergency money saved away, if you have major complications and you can't get to the health facility in time. And time is really important when you're looking at labor. You need to get there in time. So providing bicycle ambulances to the community makes that commute, or makes the linkages from the community to the health facility that much stronger, because it gives people an opportunity to get there faster. So we're grateful for the opportunity to have been able to provide bicycle ambulances to at least ease the burden of transportation for pregnant women.
As a project, Promise Project, we are using the care group approach as a way of reaching people in the community. A care group is a group of 10 to 12 volunteers. They meet and they are trained in one of the modules by the health promoters. In Malawi, literate level is somehow low, so we are using the modules, the flip charts. The flip charts has the pictures which shows everything what we are promoting. So after they learn from the health promoter, each and every volunteer goes and visits his or her household, which she or he represents in the community. So at the household level, they meet with the husband and the wife, and the message goes to both of them. Here in Malawi, we promote the 6 food groups. So we are promoting that each and every pregnant woman is supposed to eat 6 food groups. At least every day should try to eat not less than the 6 types of food.
This is a food demonstration stand. This is helpful to the community, basically because they're taught knowledge on how they can use locally available foods, and then how they can put good use into these local available foods for the good health of the children, and also the mothers, and also their families in general.
Here we have demonstrated the community complementary learning and feeding session. The whole purpose of this session is for mothers, the under 5 children, to come together to teach each other how to prepare delicious meals. Because most of the times we have the food in our homes, but the challenge is how to prepare the meals, to make them so that they can contain the 6 food groups that Malawi is promoting for children to be healthy. From the reports that we have received so far, we could see a lot of changes from the children. They are gaining weight, and the ones that we are not improving, they are being referred to the hospital and they're being helped under the nutrition department. Since we started the Promise project, we have seen a lot of improvement in various areas: hygiene and sanitation, complementary learning and feeding sessions, all the initiatives that we have been doing, and we can see the community members are supporting the project initiatives, and we hope that different projects like this would continue taking place.
Emmanuel International works in 7 countries around the world. Emmanuel works in Africa, in Malawi, Uganda, Tanzania and South Africa, also in the Philippines, Haiti and Brazil. The focus we do is basically through the local churches in all those countries and helping them do what they do better. For example, we have water projects, we have widows and orphans, we have feeding of the hungry. In many areas we help when there's a disaster. The Promise project has been well received by the people in Malawi. It's been said it's one of the best projects they've ever had in helping reduce the mortality rate of the young children. Oh, we are very excited, and I'm especially excited because I was at the beginning of putting this Promise project together, and now we have these 3 countries working with the Promise, doing many great things in the countries we are working in. We've already been told by our partners in these countries that they have learned so much, and they are so excited to be able to work with so many more people to save so many more lives, and to be able to help the children up to the age of 5 get proper nutrition.